cancer diagnosis is a frightening diagnosis. It's a hard to crack diagnosis, and regardless of the status, socioeconomic status, or portfolio status, you don't remain the same. In one way or another, you get affected in terms of your psychosocial well-being, and eventually that will have some form of effect on your general health and your well-being, and it affects everyone from the patient to the family members and friends. So among the commonest mental health issues or problems that we usually see in patients, we usually categorize them as immediate. Those are the ones that occur within days to a few weeks after receiving a cancer diagnosis. We can have the intermediate mental health issues or problems, and those happen within weeks after the diagnosis, and we have the long-term mental health challenges, and these happen within months to years following the cancer diagnosis. The most common immediate mental health challenge is anxiety. Someone will be scared, they will start having palpitations, they will start sweating, they will feel restless because they have had that most likely they are diagnosed with cancer. The other immediate mental health challenge that most cancer patients face is to do with cognition. Patients usually get cognitive problems or difficulties, whereby upon hearing that one has a cancer diagnosis, they're going to find it hard to concentrate. Their emotions are going to be wandering over and over on what to do next. They do not know how bright the future is, so they will have cognitive problems. And thirdly, they will have adjustment problems. How somebody will wonder, how am I going to adjust with this new disease that I've never heard about in my family? How am I going to tell this to my children? How am I going to explain this to my spouse or to the immediate relatives and friends that I have a cancer diagnosis? Am I not going to become a burden to them? So somebody will keep wondering how they will go about all those. And in the intermediate, people deal with issues to do with self-esteem. Somebody who was very vocal, very focused, somebody who was very confident, they tend to withdraw because they think cancer diagnosis could be a death sentence, which is not right, which is not the case. And upon discussing with the doctors on how the management plan will go, for example, somebody has been diagnosed with, say, for example, breast cancer, and in the management plan, there could be a mastectomy. Mastectomy means cutting off that breast which has been affected by the cancer. So you find that somebody has grown up to the age of 45 with 2 breasts, and now you are telling them they're going to be with 1 breast. So they're wondering, how am I going to cope up with that disability that I'm going to get at my new age? Somebody has been having 2 legs, but because they have a cancer or a squamous cell carcinoma or one of the lower limbs, one of them, in part of the management plan, involves amputation or cutting off this lower limb which has the cancer. And somebody will imagine themselves being lame when they are adult. Some of them find it hard to adjust to that. And in the long term, the most common long-term mental health challenge is depression. Depression, somebody loses interest in the activities that they liked or they did pleasant or with pleasure. Somebody who was social gets to withdraw from the public. Somebody has what they call a melancholic mood. All the time you feel so low, you feel you don't want to interact with anybody, you do not want to associate with the people that you used to relate to, workmates, your family members. You lose hope, and worst of it all, people start get ideas about death, and to make it worse, suicide. So, which is the worst scenario in patients with cancer diagnosis. When somebody worries a lot, it's going to affect the levels of the different hormones. We have what we call the hypothalamus, pituitary, and adrenal axis. So there is an interaction between the hormones in the brain, that is from the hypothalamus and the pituitary glands, which are sent, the reflexes are sent to the adrenal glands, and this causes an increase in what we call the stress hormones, that is cortisol and adrenaline. So most of the times when these hormones are very high or they are not well balanced, it's going to cause a dysregulation. Dysregulation means an imbalance in the biochemical reactions within the body, whereby the body is going to release a lot of cytokines, which are going to promote more inflammation. And somebody who had a small wound, the wound ends up becoming bigger and bigger because the stress hormones were very high, and the person, because the person was stressed up, they kept worrying all the time, they were anxious, they were depressed, the stress hormones rise up, and somebody progressed because there were more inflammatory mediators or cytokines that were released into their system. The other way that mental health or instability affects cancer care is that most of the patients who have mental health issues, they tend to withdraw from care, and we tend to lose them in terms of following up. They do not come to the hospital on appointment. We schedule appointment to receive treatment in 2-3 weeks, and you find somebody comes after 3 or 4 months. So, and you find that most of the time cancer treatment works in cumulative doses. The dose that I give today will be the foundation. It will lay the foundation for the next dose, and the next dose combined with the first one makes another foundation for the third. So in that cumulative order, the chemotherapy drugs are able to fight against the cancer cells. So if a patient is not adhering to treatment, is not fulfilling the appointments because they are mentally down, they are mentally affected, it's going to eventually affect the outcomes of treatment. Here at Uganda Cancer Institute, we believe communication is the first step towards achieving our goal together of the best treatment outcomes for the patient. And once the patient steps foot in the hospital at our reception desk, we give them all the relevant information that they have to know about the cancer diagnosis, and we do that through our navigation program. We give the patient information about what risk factors were there for this cancer to develop. We give the patient on the different investigations that we shall have to do for us to determine the stage of the disease that eventually will enable us to manage the disease appropriately as per the guidelines that we have. And we emphasize support from the family, support from the friends, for them to do the investigations. For example, one might have to do a CT scan, might have to do an MRI to enable us to stage the disease appropriately. They might have to do tumor markers. So we endeavor so much to communicate to the patient and their family to know the rationale as to why they have to undergo all these tests. Number two, we have family conferencing activities. Family conferencing, like it's still part of effective communication. We invite the patient along with the responsible family members and friends that have a role in deciding for the patient, with whom we share the information, or we share the challenge we have at hand, and we endeavor to come up with a joint solution together as a team, medical team, along with the patient and his family. Look, here we are, we have cancer of the prostate. It's at this stage. This is the treatment plan. This is how we are going to go about managing you, and this is the treatment that you're going to receive. And we hope that while you're on treatment, it will last for this duration. And these are the expected side effects. This is what we are going to do to address some of these side effects. Some of them you might experience them immediately, others you might experience them in a couple of days after your treatment, and the others might be long term. However, we also have this other challenge. So that effective communication that we have through family conferencing and navigation programs, it's very important in addressing mental health challenges. Otherwise, somebody will worry about the chemotherapy they are going to get, because they've heard out there that once you start chemotherapy, you're going to lose hair, you're going to have problems with appetite, you're going to have weight loss, But if we prepare somebody psychologically for this, and we also tell them we have remedies for all these things. Okay, some of them might experience them, whereas others may not necessarily experience all these side effects of treatment. The other program that we have counseling services. We have a trained and well-trained and qualified counselor, as well as a social worker who will help us address the mental health issues for these patients. Despite the fact that I've had an interaction with the patient, they will still require more time, or they will still require a whole team of the medical counselor along with the medical doctor. So we try to address the mental health challenges. Some of these mental health challenges are attributed to the social economic status. You have come and we need to do a CT scan or an MRI to stage the disease, but you do not have the resources, the financial resources. So we link you to our social worker who will help you navigate some of these barriers to address some of these issues. Yes, you're already worried about the disease, but at the same time, you are worried about meeting the costs of the investigations, supporting yourself when you're in treatment. So all those bring about stress, they bring about anxiety, they bring about worry, and they tend to have a cumulative effect on the mental well-being of our patients. Lastly, we have survivorship programs. Survivorship programs, it's a broad perspective of approach, but in line with mental health, we always invite ex-patients or former patients who have won the battle of cancer, who have gone through all the stages of treatment, and they have been declared cured of cancer. So we believe these are the stewards to give more hope to the newly diagnosed patients. That look, I was also having a cancer diagnosed with, say, breast cancer. This year, I came to the hospital, the doctors took me through this. So they took me through the steps that I will undergo through, and I went through the chemotherapy, I went through the surgery, I went through the radiation therapy, and here I am, alive and kicking, and I've gone back to my normal ways of life. So we believe that this peer-to-peer support between the survivors of cancer along with the newly diagnosed, when they interact, they're able to exchange information, but it also gives hope to the new patients diagnosed with the disease, and they also get tips on how to cope up with the diagnosis and the treatment. The cancer is not spread from one person to another. So if you have a friend, you have a relative who has cancer, it does not mean that you are also going to contract cancer from that person. No. However, we have what we call risk factors. These are behavior or genetic factors that put one person at a high risk, or that increase the chances of one person contracting a given type of cancer compared to the other. And these risk factors vary from one cancer type to another. If I am to look at the risk factors for cancer of the cervix, they are different from the risk factors from cancer of the breast. They are different from the risk factors of cancer of the esophagus. However, if we are to look at it in a broader perspective, there are 2 or 3 common things that increase the general chances of one developing cancer or developing a malignancy. One, there should be a genetic predisposition. Genetic predisposition means in your DNA makeup. These days we hear a lot about DNA, but more on the side of paternity. But this time, it's in terms of the way your genetic material is built up in your DNA. There should be a risk that in case one of the genes gets altered easily, the chances of developing cancer are high. So with this genetic predisposition, it has to combine with the environmental and lifestyle factors. So the environmental factors, they include air pollution, they can include the routine activities that people do. When we look at the lifestyle, the major lifestyle components, that is in terms of diet and physical activity. So most of the times people have a sedentary lifestyle. Sedentary people do not engage in physical exercises or activities that enable you to regulate the metabolism or to regulate the input and the output of the energy in your body. And people sometimes people who consume alcohol, actually most of the times people who consume alcohol in huge amounts, to be particular, more precise, they stand a higher risk of contracting any type of cancer. People who smoke cigarettes or smoke pipe, people who chew raw tobacco, because raw tobacco is even worse because the nicotine and the tar, which are carcinogenic agents, they are highly concentrated in the raw tobacco. So those factors interact: genetic predisposition, environmental factors, and the lifestyle. So if you already have a genetic predisposition, for example, you have a relative who has been diagnosed with a particular type of cancer. We know some types of cancer follow a genetic pattern, like breast cancer. If your say your mom, your auntie, your sister, those are first-degree relatives, have been diagnosed with a cancer, chances are high that you stand a high chance of getting breast cancer. If it's a second-degree relative, the chance is there, but not as high as when it is a first-degree relative. So those are particular types of cancer. The same applies to cancer of the colon. They tend to follow a genetic pattern. We have cancers of the upper gastrointestinal tract, because this is where people smoke from. This is where the alcohol passes. So you find that most of these people who take huge amounts of alcohol, they smoke cigarettes, they're going to end up with cancer of the esophagus, cancer of the tongue. They're going to get cancers majorly affecting the upper digestive system, are a part of the digestive system. So these risk factors vary, and what we need to do is to mind our lifestyle. Mind our lifestyle in terms of what we eat. We encourage people to eat more of natural foods. Okay, instead of having the sodas and the snacks all the time, have something natural. We have natural juice instead of having alcohol. Have your passion fruit juice. Okay, we encourage people not to ban polythene. Eat food that is prepared. Back then, we used to prepare food in banana leaves. Okay, and it used to be very delicious and very nutritious. So these days, people prepare food in kavera. So that kavera, once the food boils and it heats up, you do not know what chemicals are going to be released into the food that you are going to consume. Okay, let's have better health-seeking habits. Let's go for screening. Let's disease it from activities that are going to pollute our environment in terms of the water, in terms of the air pollution, because those chemicals eventually end up in our bodies and they're going to cause disturbances in the arrangement of the genes in our DNA. Again, speaking about the risk factors, when I say you are at a high risk of getting a particular type of cancer, it does not necessarily mean that straightforward red card you're going to get this type of cancer. No, this just puts you on high alert that the probability is high. Take an example. If you are on the road and the prescribed speed limit is 120 kilometers per hour, okay, and you are driving at 200 kilometers per hour speed, the police officer or the traffic officer will say the chances of you getting an accident are very high. But what can be on your side? You're traveling at that speed and you reach your destination when nothing has happened to you. However, if you do not limit yourself, you do not control well, you have a high likelihood of getting an accident. The same applies. You might be driving at a normal speed, 50, 60 kilometers per hour, but because there is another reckless driver, he hits you off the road and you still get involved in the accident. So these risk factors, they just put us on high alert that something might go wrong. But you might find that you do not have any of the risk factors and still you end up getting the disease or the cancer diagnosis. So what I'm trying to communicate is prevention is better than cure. And the goal in cancer care, screening means you walk into the health facility when you do not have any symptoms. You are 40 years, a man, walk in, say, I have come to screen for cancer of the prostate without any urinary symptoms. You are a woman who is of reproductive age, walk into the health facility, come at Uganda Cancer Institute, say, I have come to screen for cancer of the cervix, I have come to screen for breast cancer. The doctor or the nurse or the midwife examines you and then they tell you, these are your results, please come again after this duration of time, depending on the risk that you carry. If we are not able to capture the disease at the screening stage, at least let's make an early diagnosis. When the diagnosis is made early, you receive treatment and eventually you can be cancer-free. Thank you.